Assalamu alaikum. So the optic nerve is one of the most important cranial nerves. In this video, we'll be talking about the neurosurgical anatomy through the Rhoton dissection. If you haven't seen our first video about the olfactory nerve, make sure to have a look on that video through the link above. This is Mohammed Draz, and this is your knowledge platform about the brain, spine, and beyond. So let's start with the first dissection. So as you can see here, the optic nerve is highlighted in yellow, which enters the optic canal and then into the orbit. It remains within the central nervous system as it's invested into the optic nerve sheath, which is basically an extension of the dura. Then we have the ophthalmic. This is the optic nerve sheath. Then the ophthalmic nerve and the trochlear nerve basically cross on top of the optic nerve in the apex of the orbit, while the abducens nerve remains lateral. So if we go again, so we have the optic nerve, we have the optic nerve sheath, and then we have the ophthalmic nerve and the trochlear nerve cross over on top, and the abducens nerve is staying lateral to the optic nerve. If we look into this nice illustration where you can see the top view of the orbit and the bone of the superior orbital wall has been taken out, you can see here that the superior rectus muscle is here, but now it's retracted so that we can see the optic nerve within the orbit. We can see again the optic nerve sheath from the top view, which is continuous with the dura as mentioned earlier. If we look into this dissection again, this is the frontal skull base or the anterior skull base, where you can see the optic nerve here under the falciform ligament before it goes into the optic canal. And then we see here the olfactory tract as it's kind of going superior to the optic nerve. Again, if you haven't seen the olfactory nerve video, make sure to watch it through the link above. If we go through another dissection, you can see here that the optic nerve. Here again, we are still within the kind of anterior skull base with the start of the middle skull base. You can see the optic nerve here as it enters into the optic canal, with the optic nerve sheath here is kind of incised and pulled away with those sutures. We can see the anterior clinoid process, which contributes to the lateral wall of the optic canal and the roof of the cavernous sinus. And when drilling the anterior clinoid process to open the lateral part of the optic canal, the superiorly coursing trochlear and oculomotor nerves can be injured. So you can see that in some of the neurosurgical procedures that we have to take the clinoid process and to expose the optic nerve. This is a really important anatomical dissection for a lot of the neurosurgical procedures. So that's trochlear nerve and oculomotor nerve, and again the anterior clinoid process is in that area. Then within the posterior wall of the sphenoid sinus, so we have here the sphenoid sinus, we have the optico-carotid recess. This is the optico-carotid recess between the impression of the ophthalmic segment of the internal carotid artery and the impression of the optic nerve. The tuberculum sella is basically located anterior and inferior to the optic chiasm. So again, through that again, so we here within the sphenoid sinus, you can see the optico-carotid recess, which is the space between the, as mentioned, the ophthalmic segment of the internal carotid artery and the impression of the optic nerve. And then we have the tuberculum sella, which is located anterior and inferior to the optic. Now we are going through kind of the medial view of the sphenoid sinus. So that's the sphenoid sinus in yellow. You can see the optic canal here higher up has been exposed, so you can see the optic nerve. That's kind of another view from the side rather than the previous picture we were going showing the sphenoid sinus from down. But this one is the side, so you can again appreciate the sphenoid sinus and appreciate the internal carotid artery the optic canal, which is open to see the optic nerve. Then you can see here the optic chiasm higher up, which has been exposed as we drilled the tuberculum sella. Often here you can see some branches of the superior hypophyseal artery, which supplies the optic chiasm. And those should be preserved if possible, so that you can avoid the injury to supply to the optic chiasm. If you look at this closer view showing the infundibulum of the pituitary gland projecting inferiorly from the third ventricle behind the optic chiasm, which is somewhere around there. Then if we look into this view, you can see the anterior communicating artery in this view here, which is seen above the optic chiasm. So you have the optic chiasm, the optic nerves, and then we have the ACOM. The relationship between the is variable, and it depends basically on the length of the A1 segments. And branches, again, of the superior hypophyseal artery can be seen supplying the chiasm, as mentioned earlier. Then if we look, that's through an endoscopic view of the left cavernous sinus. So the cavernous sinus, again, is highlighted in yellow. And then you can see the optic nerve is higher up. And this is entering the optic canal, which then gives rise to the ophthalmic artery. That's the internal carotid artery, and then that gives rise to the ophthalmic artery. So again, just for explanation, again, this is endoscopic view through the cavernous sinus. You can see the optic nerve is seen as it enters the optic canal above the internal carotid artery, which you can see giving rise to the ophthalmic artery that basically follows the optic nerve into the optic canal. And then looking here, you can see the oculomotor nerve, you can see the abducens nerve, and then we see the maxillary nerves in this picture. Here, that's similar to the view that we were talking about in the olfactory nerve video. You can see the optic nerve and kind of the optic chiasm as seen from above, and we can see the olfactory tracts again. Here, we're looking again at the ophthalmic arteries. If you remember that side view that we were looking at from the cavernous sinus, we saw the ophthalmic artery coming from the internal carotid artery. Here you can see the ophthalmic artery, but this is more of the superior view. So you can see the ophthalmic artery is coming from the internal carotid artery. That's the supraclinoid segment of the internal carotid artery. And it goes with the optic tract or the optic nerve into the optic canal. So the optic nerves again as they enter the optic canal. So those are the optic nerves, internal carotid artery, and the ophthalmic arteries are here. Then if we look into this view, you can see here that's the optic nerves, and this is the optic chiasm, and here we are kind of pushing the optic chiasm away. So the optic nerves are seen from a terional craniotomy, and the medial optic nerve are fibers decussate in the optic chiasm. So here's the optic chiasm, and the fibers continue to the lateral geniculate nucleus, midline section of the brain. You can see a wonderful illustration of the ventricles and the corpus callosum. But what you can see here is the optic nerve as it lies here. And this is the internal carotid artery. So again, this is the optic nerve, which leads to the optic chiasm, which is intimately related to the anterior third ventricle, the anterior part of the third ventricle. And then we have a thin lamina terminalis. This is very thin lamina terminalis. And the lamina terminalis is part of, if you're doing an ACOM aneurysm, then you can open that to get some CSF, which the lamina terminalis projects superiorly from the optic chiasm with the angle between these forming the supraoptic recess. And then we have the pituitary stalk, which emerges from the hypothalamus and the third ventricle posterior to the optic chiasm. So here is the pituitary stalk. Here we can see the supraoptic recess, which lies between the lamina terminalis and the posterior projection of the optic chiasm in the third ventricle. So that's the brainstem. This is kind of a more close view. This is the third ventricle here, highlighted in yellow. And you can see the optic chiasm is here. you can see the lamina terminalis, which is kind of forming the anterior inferior wall of the third ventricle. And here is the supraoptic recess, which we just mentioned in the previous dissection picture. Here we're going through a superior view of the anterior third ventricle. So you can see we're going through into the ventricle and looking from above, which basically what you can see here, the posterior portion of the optic chiasm with this is the supraoptic recess above the infundibular recess. So again, we can see the optic chiasm, the supraoptic recess, and the infundibular recess below it. Again, another picture which is basically showing the lamina terminalis, which has been opened to enter the supraoptic recess of the lateral of the third ventricle. Here, the third ventricle is seen through the lamina terminalis. That's a wonderful dissection. Again, you can see the optic nerves, the optic chiasm, and the most of the circle of Willis in the base of the brain. Here you can see the cerebral aqueduct, which can be seen by opening the lamina terminalis again. So again, that's going all the way. You can see the cerebral aqueduct. Here you can see the pituitary stalk, which is seen emerging from the hypothalamus, which is posterior to the optic chiasm. The pituitary stalk basically emerges from the third ventricle and posterior to the optic chiasm and between the optic tracts, which is you can see here. Then we can see the third ventricle, which has been opened inferiorly as we split the midbrain. Those are just mainly dissections. That's not going to happen in reality, but it's really important to appreciate the relationship. So here we cut through, splitting through the midbrain, and we're looking into the third ventricle from inferiorly. And then you can see the posterior impression of the optic chiasm within the third ventricle, which separates the infundibular recess from the supraoptic recess, which is bounded superiorly by the lamina terminalis. So again, you can see the optic chiasm, the infundibular recess, and superiorly, we have the lamina terminalis. Then we can see the optic tract, which courses superior to the uncus, and the basal vein of Rosenthal before it ends into the lateral geniculate nucleus. So that's the optic nerve going all the way posteriorly to end into the lateral geniculate nucleus. And that's superior to the uncus and the basal vein of Rosenthal. Here you can see the optic tract, which courses, again, superior to the uncus. You can see the uncus here, and medial to the temporal horn. Here, part of the uncus has been removed, so you can see the temporal horn before terminating into the lateral geniculate nucleus. We're kind of repeating the same points again so that you can appreciate that and make the information solid in your mind. In this next picture, we're looking at the right optic tract, kind of the medial perspective as along with the uncus of the temporal lobe. After we removed the uncus, then we have a wider picture of the whole optic tract. So the optic tract can be seen from the inferior perspective as it approaches the lateral geniculate nucleus, which gives rise to the optic radiation. So optic tract, lateral geniculate nucleus, and then it gives rise to the optic radiation that courses along the roof of the temporal horn. And then here we have the Meyer's lobe, which carries the fibers related to the contralateral superior visual field, which is the inferior portion of the retina. You need to revise your neuroophthalmology part. After we dissect a bit more, the inferior aspect of the thalamus is basically seen highlighted in yellow here. And then the optic tract is terminating into the lateral geniculate nucleus of the thalamus, which again gives rise to the Meyer's lobe and the rest of the optic radiation projecting posteriorly and going all the way to the primary visual cortex of the calcarine sulcus, as you can see here. In this part, the temporal lobe has been removed, so we are just left with the frontoparietal lobes. And then now we are exposing the insula, which is highlighted in yellow. And basically here it's just to show the rest of the optic radiation and pathway of the optic nerve. You can see the inferior limiting sulcus of the insula is immediately superior to the Meyers's lobe. And then the temporal horn can be accessed inferior to the Meyers's lobe and the optic radiations through a transcortical approach. So this is how you can reach to the temporal horn. We can see here that the optic tract is seen as it courses to the lateral geniculate nucleus here. So optic tract, lateral geniculate nucleus, which gives rise again to the optic radiation that travels in the roof of the and the lateral wall of the temporal horn. You can see here the optic pathways. This is a very nice MRI tractography which shows a lesion of the left geniculate nucleus. Then looking at this white matter dissection, you can see the optic radiations, which comes from the lateral geniculate nucleus. Here is the lateral geniculate nucleus, all the optic radiation coming out of it, and it courses on in the roof of the temporal horn. So here is the temporal horn. All the optic radiation is projecting posteriorly, and that's again lateral to the atrium of the ventricle to reach to the calcarine sulcus. The optic radiation are then separated from the temporal horn and the atrium by the tapetum of the corpus callosum. So we have the optic radiations separated from the temporal horn and the atrium of the ventricle, so both of them, the atrium and the temporal horn, by the tapetum, and the tapetum is part of the corpus callosum. Very nice illustration of those tracts. Then we have the primary visual cortex surrounds the calcarine sulcus. So the calcarine sulcus is seen here and the primary visual cortex is around it. Then you can see also the calcarine sulcus and the parieto-occipital sulci is seen. The fiber carrying the lower visual field terminate along the calcarine sulcus in the cuneus, while those carrying the upper visual field terminate in the lingual gyrus. So it's kind of crossing, and that's why we get the changes in the visual field with lesions. So just going through that again, so we have the calcarine sulcus, parieto-occipital sulcus, the fibers which comes from the lower part of the visual field will end in the calcarine sulcus in the cuneus. So from the lower visual field will go up, while those coming from the upper visual field will terminate in the lingual gyrus. Then we look here at the optic radiations travels along the roof of the roof and the lateral wall of the temporal horn as they travel to the cortex surrounding the calcarine sulcus, which forms the impression in the atrium of the lateral ventricle, known as the calcar avus. This is the calcarine sulcus, and those again, the optic radiations traveling along the temporal horn on the roof and the lateral wall, and then it goes towards the to the cortex surrounding the calcarine sulcus, as we have seen in the previous dissections, which will form, this is the atrium of the lateral ventricle. This will form kind of a projection or an impression into the lateral ventricle that's called calcar avus. You will probably need to watch those videos multiple times so that you can digest the whole neuroanatomical knowledge here and the neurosurgical pathway of those cranial nerves. Please stay tuned for the next video, which will cover the oculomotor nerve.